Hello students, welcome back to Community Health Nursing. Today we are going to study regarding ICDS scheme. ICDS means Integrated Child Developmental Service Scheme. So actually this scheme is coming under one of the program which is coming under the community nutritional programs, otherwise national nutritional programs. So usually they used to ask even for 5 marks as a short note also, what do you mean by ICDS project or ICDS program. It has that much of importance in the nutritional programs in India. So let us see what do you mean by ICDS scheme. So it has been initiated on 2nd October 1975. So this is also on the day of Gandhi Jayanti, 2nd October. As you may have noticed, many of the national health programs, it used to start on October 2nd on the remembrance of our Mahatma Gandhiji. So it is also initiated on 2nd October 1975 during the 5th 5-year plan. So always remember ICDS scheme has been initiated during the 5th 5-year plan. So always when you study, it will be better if you can connect and study, because already we have studied various 5-year plans. So under the 5th 5-year plan, you can highlight the importance of ICDS project. It has been under the Ministry of Social Welfare. So ICDS scheme is under the Ministry of Social Welfare. Especially they were aiming towards the nutritional aspect of children. Initially, the ICDS was started in around 33 community developmental blocks, CDB. What is CDB? Community Development Blocks, as an experimental project. That means around by 1975-76 കാലഘട്ടത്തിൽ ഒരു 33 കമ്മ്യൂണിറ്റി ഡെവലപ്മെൻറ്റ് ബ്ലോക്സിൻ്റെ കീഴിൽ ഒരു എക്സ്പെരിമെൻ്റൽ പ്രൊജക്റ്റ് ആയിട്ടാണ് അത് സ്റ്റാർട്ട് ചെയ്തത് ICDS. Later it has been expanded. So recently if you see, you can see that everywhere in all the villages we can see the presence of ICDS scheme. So let us see the further development what has happened in ICDS. So when we look into the ICDS centers, when we look into the population, we can see that each for 400 to 800 population there will be one Anganwadi center. What is AWC? Anganwadi Center, because this ICDS scheme, it is working through the Anganwadi centers. ICDS എന്ന് പറയുന്ന സെൻറ്റർ തന്നെയാണ് നിങ്ങൾ ഈ അറിയപ്പെടുന്ന അംഗൻവാടി സെൻറ്റർ. So many of the people, if you tell ICDS, they may not be able to know, but if you ask about Anganwadi centers, everybody is aware in our state. So this ICDS center is the same as knowing as Anganwadi centers. So like for every 400 to 800 population there will be one Anganwadi center, and next again for next 800 to 1600 population there will be one more Anganwadi centers. Again 1600 to 2400 population there will be one Anganwadi center. So that means for every 800 population the Anganwadi center will get multiplies. So each one Anganwadi center will get multiplies for every 800 population. So even we can see for even 150 to 400 population, they may sometimes have a mini Anganwadi center also. The population norms for Anganwadi centers in tribal or in the desert or in the hilly or in the difficulty areas, it also varies. നമ്മൾ PHCയുടെയും CHCയുടെയും ഒക്കെ പോപ്പുലേഷൻ കവറേജ് കാണുന്നത് പോലെ തന്നെ അംഗൻവാടി സെൻറ്ററിൻ്റെ കവറേജിലും ഡിഫറൻസ് ഉണ്ട്. ബിക്കോസ് as we have told, the rural we have to develop the rural areas, or we have to give more concentration towards the tribal and hilly areas. Then only the equalization of the health services can be attained. So in order to that, even one Anganwadi center has been given for 300 to 800 population, wherever there is tribal area or a desert area, hilly area, or wherever transportation never reaches, like such type of difficulty areas, there will be one Anganwadi center for 300 to 800 population, and for 150 to 300 population there will be one mini Anganwadi center. So this is about the population coverage, how it cover the Anganwadi, each Anganwadi center. So let us see what are the objectives. So as you all know from the I'm very sure that as a final year student or as a degree student, you all know about what are the function or what are the activities of an Anganwadi center. So, like I am very sure in your BSc second year community health nursing posting also, you may had this Anganwadi center postings. Even in BSc fourth year also, let us hope we will be getting a posting in Anganwadi center. Otherwise also, I'm very sure many of your villages or many of your houses near to that, you may have seen at least Anganwadi worker. Otherwise, we all have at least gone to Anganwadi at least in our lifetime once. So let us see the objectives. To improve the nutritional and health status of children between 0 to 6 years of age. Because as we all know, in Anganwadi, all the preschoolers, toddler to preschoolers, mostly they go there. Like especially from 3 to 6 years, they go to Anganwadi, especially for the informal education, in order to start their education, so that they will get a guidance for the further schooling. So first thing is their nutritional aspect. Next is the health status, so that they can concentrate on the immunization, supplementary nutrition factors, therefore informal education, the starting stage of the education, all these things they concentrate on children those who are less than 6 years, to lay the foundation for proper psychological, physical and social development of a child. So in a Anganwadi center, actually they look for the physical growth. അതിന് വേണ്ടിയിട്ടാണ് ന്യൂട്രീഷണൽ സപ്ലിമെൻറ്റ്സ് എല്ലാം ഉള്ളത്. നെക്സ്റ്റ് ഈസ് സൈക്കോളജിക്കൽ. ദാറ്റ് മീൻസ് ദേ ആർ പ്രിപ്പയറിംഗ് സൈക്കോളജിക്കലി ടു ഗോ ടു സ്കൂൾ. ദേ ആർ getting prepared towards meeting strangers, having a different environment which is out of their house. അല്ലെ, വീടുകളിൽ നിന്നൊക്കെ ആദ്യമായിട്ടായിരിക്കും പേരൻസ് കൊണ്ടുവിട്ടിട്ട് പോവുക. കുട്ടികൾ കരയും പേരൻസ് വിട്ടിട്ട് പോകുമ്പോൾ. So they will get that familiarity, or they should start getting the psychological support or psychological strength to face the society. It will start from the Anganwadi centers. And same way, social development, they will all the Anganwadi teachers, they will teach the students regarding the social developmental factors, like how to greet others, how to wish others, in which way they have to respect the elders, how they have to what should be their daily routine, the personal hygiene importance, their daily activities, everything. So like social development also, it really plays a major role. Then reduce incidence of mortality, morbidity, malnutrition and school dropout. Because see, when the students they start going to Anganwadi, of course after that they will be getting direct admissions towards the first standard. So government schools, they really take up the children from Anganwadi. So there will not be much school dropout. So even a below poverty line child also will be getting the access towards the further education, towards the school. Then nutritional aspect, there will not be any they want really to reduce malnutrition, all the disease aspect, mortality, morbidity, all these things to be get reduced. This is also one of the main objective of ICDS project. Then enhance the capability of mother and nutritional needs of the child through proper nutrition and health education. So they provide various health educational activities. They emphasize the importance of nutrition, not only among the children, among the mothers, those who are mothers of under 5 especially. So capability of the mother can also be raised, so that the child development will be much proper even in the home also. To achieve effective coordination among various departments which are working towards the promotion of child development. As we all know, there are not only ICDS project, there are various projects. Like even in the MCH we can see there is a factor of C, that means reproductive and child health, or MCH, maternal and child health. So all these child health activities, all the various project, even they really work in integration, or they just really coordinate and work with this ICDS project, so that all the children those who are below to 6 years, they will get the benefit. So under the ICDS, various services is provided for the under 5 children. So let us see what are they in the next figure. So see, this is all the ICDS package coverage. So these are the various services which is provided under ICDS package. Which are they? First one is a supplementary nutrition, as I have told, non-formal education, nutrition and health education for women, medical referral services, health checkup and immunization. So always remember there are 6 packages coming under ICDS project. Which are they? Supplementary nutrition, non-formal education, nutrition and health education for women, medical referral services, health checkup and immunization. So these are the various services. So as we have seen, which all are the beneficiaries. So again, I am emphasizing children who are below 3 years. So supplementary nutrition, immunization, health checkup and referral services is especially focusing on children who are less than 3 years, and children in the age between, that means the preschoolers 3 to 6 years, they will get the non-formal education. So because till 3 years we cannot teach a child, or we cannot give any non-formal education. So once they attain 3 years, once they become preschooler 3 to 6, they will be more focusing on the non-formal education. Then adolescent girls, like as we all know, even the adolescent girls, they are also, this adolescent age group, they are also actually called as children because they have not been into the adult category. So the supplementary nutrition, especially the adolescent girls, those who are having nutritional deficiencies like anemia, because as we all know, the menarche start during that particular age. So special nutritional supplements and even health education regarding the menstrual hygiene, these all will be given to adolescent girls under this ICDS project. Then pregnant women, so pregnant women, they will be getting the health checkup, immunization against, that means the TT immunization, their supplementary nutrition and even the health education. So this is all the beneficiaries of ICDS project. സോ നമ്മൾ ICDS സ്കീം എന്ന് കേൾക്കുമ്പം കുട്ടികൾക്ക് വേണ്ടി മാത്രമാണ് എന്ന് വിചാരിക്കരുത്. കുട്ടികളുള്ളിടത്ത് ഉറപ്പായിട്ടും അവരുടെ മദേഴ്സ് ഉണ്ടായിരിക്കും. സോ ഹിയർ നോട്ട് ഓൺലി ദ മദേഴ്സ്, ഈവൻ ദ അഡോളസെൻറ്റ് ഗേൾസ്, ദേ ആർ ഓൾസോ ബെനിഫിഷ്യറീസ് ഓഫ് ICDS because all the supplementary nutritional food, it used to get supplied through ICDS. So children under 3 years, children from 3 to 6 years, adolescent girls and pregnant women, they all get the various services which are under the ICDS package. So I hope you all will remember separately which are the services, especially for under 5, which are the services for adolescent girls, which are the services for pregnant women. So this is all about the beneficiaries of ICDS project. So further moving, let us see the provision of energy and protein in ICDS. So how much supplementary food, or what are the supplementary nutritional factors they provide through the ICDS scheme. So here in the column you can clearly see that what are the which age group they get the benefit, and what is the calorie per day they get, and the protein. So you can see like 500 calorie per child. So like age group is like from 6 months to 72 months. Then protein we can see 12 to 15 gram per child. So they have even given the expenditure also, like how much the government is providing for each age group, how much expenditure they really afford this particular program. So even the lactating mother, we can see, I have told you the beneficiaries were children who is less than 3 years, 3 to 6 years, adolescent girl, pregnant women, and not only them, even we can include the lactating mother also. So the lactating mother, their health checkup, their nutritional supplements, health education aspect regarding the various mechanism of breastfeeding, various positions of breastfeeding, how to really express the breast milk if they are working women. So these all health education they get from here. Then women in reproductive age group between 15 to 44 years, they also get the nutritional support and the various health education factors. So who all are the beneficiaries overall under this program? First beneficiary is children less than 3 years, children those who are between 3 to 6 years, adolescent girl, pregnant women, lactating mother, and women those who are between the reproductive age group, that is from 15 to 44. So overall you can remember all women those who are in reproductive age group 15 to 44 years, along with that lactating mother, pregnant mothers, and children those who are from 0 to 6 years, they all will be covered under this one umbrella of ICDS project. So let us see the delivery of services under ICDS project. So the supplementary nutrition, the types of food served is really depending upon the availability of the area, the type of beneficiary, and the type of project. See, like different areas, they will provide different types of food. It depends upon the Availability of the area, like they used to see what is the availability of that particular area, on what particular nutrition really the people are lagging in that area, who are the beneficiary, whether under 5 children are more over that area, or whether women is the more beneficiary part of that particular area. So it depends upon the various projected type of this ICDS. The provision of energy and protein already we have discussed in this table number 12. So here see this calorie and calorie per day and protein per day, it is the same for everybody, but only thing is the supply of food, it depends upon the various project, because they will be seeing who is the beneficiary and which is the particular area, what is the availability of that particular area, it all depends. So the revised nutritional and feeding norm provides more than one meal to a child who attend the Anganwadi centers. This may include a morning snack, so either it may be milk or supply of banana or egg, it can be any seasonal fruit or a micronutrient fortified food, any of these things they used to get, followed by a hot cooked meal. So as we all know, even the children, those who are going to Anganwadi centers, they get this one meal, really those who are going to Anganwadi centers. Then the children below 3 years, pregnant women and the lactating women are provided with take home ration. So whatever nutritional food or it is given to the Anganwadi centers, so those who are the beneficiaries, like those who are less than 3 years, pregnant women and lactating women, they can come and collect the ration and they can take to the home. ICDS scheme is very universal and all are eligible irrespective of the economical status. So don't think that it is only given for BPL family. നമ്മുടെ വില്ലേജിൽ അല്ലെങ്കിൽ ഈ ഓരോ അംഗൻവാടി സെൻറ്ററിൻ്റെ കീഴിൽ വരുന്ന പോപ്പുലേഷനിൽ അഡോളസൻറ്റ് ഗേൾസിനും പ്രഗ്നൻറ്റ് വിമൻ ലാക്ടേറ്റിംഗ് മദേഴ്സ് അണ്ടർ 5 ഓർ അണ്ടർ 6 ഏജ് ഗ്രൂപ്പിലുള്ളവർ, ഇവർക്ക് എല്ലാവർക്കും ഉള്ള ന്യൂട്രീഷണൽ സപ്ലൈ is there irrespective of their economical status. So it is a universal program, we can tell, for everybody. Supplementary nutrition is provided for 300 days per year. So when we reduce all the holidays in the year, we can tell that the supplementary nutrition they provide actually for the 300 days annually. Then weighing of children monthly, actually this is also one of the service, because they take the weight of the child and they will monitor whether any of the child is going towards malnutrition. We have already studied the growth chart, the road to health chart നമ്മൾ എല്ലാവരും പഠിച്ചതാണ് അല്ലേ. സോ അതിനകത്ത് especially the road to health chart is maintained till 5 years especially. So till the 6 years the children, those who are in the Anganwadi, they are actually in the right time to monitor their weight, so that we can monitor any of the child is going towards malnutrition. So this is about the delivery services. Let us see the guidelines. So the guidelines is the child with first degree malnutrition, nutritional education and health education to mother is given for them. Second and third degree malnutrition, they really get the supplementary nutritional foods extra. Then the fourth degree malnutrition, they have to be referred to the hospital, either to the PHC medical officer. We have to the Anganwadi teacher, it is her responsibility to inform the ASHA worker and the medical officer regarding the malnutritional aspect of the child if he or she is going towards fourth degree and should be get hospitalized. So these three, first degree, second degree and third degree of malnutrition, we have already seen how to find out by using the growth chart, otherwise the road to health chart. I hope you all remember that under the RCH 1 and 2 when we have studied, or under the family welfare services we have studied it very clearly regarding the growth and development of a under 5 child. Then the other nutritional and health educational aspect, the nutrition and health education is given to all the women of age group between 15 to 45 years, as we have seen the reproductive age group. Then main focus is on pregnant and nursing, that means the lactating mothers. Special classes will be conducted by Anganwadi workers during the home visit. So even if when we are also going to the community posting, during the community posting days, you also will be getting posted in Anganwadi centers. So there really we can give health education. So health education for the lactating mothers. One day we can plan health education for the pregnant mothers, health education for the mothers those who are of under 5 children, how to take care of them, how they can avoid the various accidents, homicide accidents inside their home for the under 5 child, the nutritional aspect, how to take care of a newborn baby. So regarding the baby bath, immunization schedules, their weaning diet. There are plenty and plenty of topics. And if the mother is pregnant, really we can tell about antenatal diet, antenatal exercises. So there are so much of activities or special classes which we can conduct with the help of Anganwadi worker inside in the Anganwadi center. And even this Anganwadi workers, they used to do the home visit also, especially to give this nutritional aspect, and in order to give the highlight the importance of health education and nutritional aspect. The other one is immunization. As we all know, it is also one of the factor or one of the services under ICDS project. So the children against all the vaccines against the 6 vaccine preventable diseases, so they used to get vaccination for that. Then pregnant women, they also get the TT vaccination. So the DPT vaccination and MMR vaccination for children, and even the pregnant women, they will be getting the TT vaccination. Then health checkups. As we all know, the antenatal care, postnatal care, and even the child care, those who are less than 6 years. Then immunization, iron and folic acid along with protein supplement to the expected mothers. Those who are pregnant, they will be not only getting the immunization, they will be getting the supplement like iron and folic acid to prevent from anemia. Antenatal anemia should be prevented so that the child will not be having any of the neurological defect. Then 3 antenatal visit and the physical examination. There should be minimum 3 antenatal visit and physical examination of the antenatal mother. Then referring the high risk mothers. So any of the mothers, if they are high risk, they should be referred to the medical officer. And the care of children below the 6 years of age. So how we can, what are the services we provide for less than 6 years, like measuring their weight should be checked every month. Then immunization we have to monitor. Then periodical general health checkup to screen for any other particular disease, whether any skin infection, any tooth decay, അല്ലേ, പല്ലുവേദനയുണ്ടോ, കൊച്ചിൻ്റെ കണ്ണിന് എന്തെങ്കിലും ബുദ്ധിമുട്ടുണ്ടോ, കണ്ണിൽ നിന്ന് വെള്ളം വരുന്നുണ്ടോ, സ്കിൻ ഇൻഫെക്ഷൻ, സോ എനി അതർ. സോ ഈവൻ ദ പീരിയോഡിക്കൽ general health checkup. Then treatment to prevailing infections like diarrhea and acute respiratory infections, because as we all know, children are mostly having this type of infection. Diarrhea and acute respiratory infection is very frequently seen among the under 5. Then deworming, worm infestation is also one of the main thing among the children. So deworming by using the albendazole tablets. So this is also highly emphasized for under 5 children. Then prophylaxis against deficiency of vitamin A and anemia. Vitamin A deficiencyക്കും അനീമിയയ്ക്കും എതിരായിട്ടുള്ള prophylaxis program. That means the providing vitamin A supplements and providing iron and folic acid supplements. This is all highly emphasized. Then referral services to hospital in case of emergencies and in case of danger, signs and symptoms. Then health card to the mother and child. So these all are the various activities given for an under 5 child. Then the non-formal education, it is also one of the service under the ICDS package. Non-formal education, I am very sure you all know that the preschool education to children of 3 to 6 years in Anganwadi center in every village with 1,000 population. The primary idea is to develop good attitude, values and behavior among the children before they go to the school. Then locally manufactured low cost toys are used to play. So even we can see there are so many toys and play items in the Anganwadi centers, so that they will be more attractive towards the non-formal education which is going on in the Anganwadi centers. Because we have seen the social development and the psychological development, how much importance the Anganwadi center they has among the children. Then the scheme for adolescent girls, because we have seen not only the children, even adolescent girls are also one of the beneficiary part of this particular supplementary nutrition. So there are 2 special schemes which is running for the adolescent girls under this ICDS. So ICDS സ്കീമിൻ്റെ കീഴിൽ 2 adolescent programs നടക്കുന്നുണ്ട്. So even adolescent health programs നിങ്ങൾക്ക് ഇത് ഹൈലൈറ്റ് ചെയ്യാം. So we have seen already studied adolescent health programs. So first one is Kishori Shakti Yojana. Second is nutrition program for adolescent girls. So Kishori Shakti Yojana means this program really, it provides the various nutritional supply and the health and developmental needs, even the literacy and numerical skills of girls aging between 11 to 18 years. So the special education fact and regarding the health and developmental needs, especially the provision of sanitary pads and even the nutritional fact, all this is really getting supported by Kishori Shakti Yojana. Next one is nutrition program for adolescent girls. This program is initiated during 2009 and 10 as a pilot project, and later it has been implemented to various states. So the main aim was to improve the nutritional and health status of the adolescent girls, then to provide nutrition and health education to the adolescent girls, then to empower the adolescent girl to care their personal health and nutritional needs, because we all know that the adolescent girls, they are going to change their role during that particular period of menarche. So the adolescent girl, they will be, once they attain menarche, they are going to get ready to become a mother. So we have to really give so much of health education in this particular point of view. Here the health education like safe sexual practices, and having the importance of single sexual partner, and giving the health education regarding the menstrual hygiene and how to take care of their reproductive health, and what is the importance of getting nutrition during this part, because during this period especially we see a tendency of these girls, they go for unwanted dieting. They want to see themselves very slim and fit, so they used to avoid all the natural foods and they turn to some junk foods. All these tendencies are very more among the adolescent girls. So really we have to give the importance of nutritional importance of that particular age, because see, then adolescent girl, actually during that period all their reproductive system, they get matured, the uterus, all the reproductive organs, so they should really get very good nutrition, because even menarche, when they attain, they lose blood every month. So there is an importance of iron and folic acid, there is an importance of vegetable consumption, green leafy vegetables, all these things to be highly imparted. So this Kishori Shakti Yojana and the nutritional program for adolescent girls, this too has also been even integrated under the ICDS project. So here, as we all know, the beneficiaries are especially the undernourished adolescent girls. It is not for all the adolescent girls. We can especially see the beneficiaries are undernourished girls, those who are having less than 30 kg weight between the age 11 to 15 years. So even you can also refer that any of the children, those who are between the age group 11 to 15 years, having less than 30 kg, they can be one of the beneficiary of this particular program. Then the adolescent girl, those who are between 15 to 19 years, those who are less than 35 kg body weight, so they both are the beneficiaries of this particular program. So the what all services they get is around 6 kg free food grain per month for each adolescent. So the adolescent girls, those who are less than 30 kg and those who are less than 35 kg as per the age 11 to 15 and 15 to 19 years, 30 or 35 kg less ആണ് എങ്കിൽ they will get 6 kg free of food grain every month for per adolescent. Then weight measuring 4 times in a year. So such type of girls, they have to monitor their weight minimum 4 times in a year. That means at least 3 to 4 months once they have to get the weight checked. So these are the various services under this nutritional program for adolescent girls. Now let us see what is the role of Anganwadi worker in the ICDS project, because we have already emphasized Anganwadi center is the main center through which the ICDS project services are provided. So the traditional local women who is the center point for delivery of services under ICDS project is Anganwadi worker. So her functions are, first one is she is a multi-purpose agent, works close with the community. She direct link between the children and the mothers. She assists the survey of community and to find out the various beneficiaries under the ICDS project. She organizes the non-formal education sessions. Even she is as a teacher. That's why we call her as Anganwadi teacher. More than Anganwadi worker, we used to call her as Anganwadi teacher, because she gives the non-formal education to the children. She provides health and nutritional education even to the mothers. Regarding all this free supplement, everything, she makes the mothers aware about what all things they really get from the government. Then she assists the PHC staff in providing this health services. So the PHC staff, they used to tell to her when there is any reproductive health clinic or any adolescent clinic, any immunization program is going on in the PHC, which day it is available, all these things the PHC staff will make her aware, and she will really tell the services towards the mothers. Then maintaining the records, she has to maintain the various records like immunization and feeding and attendance, like how much food supplements has been given, to whom they have given, what is the attendance, all these things she has to maintain. How many children is attending the Anganwadi center, how many children are getting non-formal education, how many children are there less than 3 years who get the benefit, how many antenatal mothers are there, how many adolescent girls are there who is less weighted, who is getting the benefit of adolescent girl programs. So these all things she has to really monitor, and she liaises the members from various disciplines like block administrator, village health nurse, asha worker, and she has even she has tie up with the local schools. See, that means she's, that's what the word is clearly mentioned, she's a trained multi-purpose agent. So there is multi-purpose for her, so she really help in administrators by providing this type of data. So the block administrators also get the help from her by giving all the census regarding the number of antenatal, because always as we asked on the Anganwadi teacher or Anganwadi worker, it will be in the tip of her tongue how many antenatal mothers are there under her population, and how many adolescent girls having nutritional problems, how many non-formal education you are she's providing for how many children in her Anganwadi, all these things she knows. Immunizational status, everything, each and everything records she maintained, so she can give all this to the health authorities or administrators. Then village health nurse, she can get the help from her, she can work with asha worker, because when we have studied under NRHM program, when we studied the role of asha worker, we have seen the asha has a work along with two members. Who are they? Asha worker with Anganwadi worker, asha worker with the ANM nurse in the PHC. So she actually work along with this Anganwadi worker and the staff nurse, ANM nurse. So she has to work with asha worker also. Then with local school, as I have told, the government schools, they really come to the Anganwadi teacher, and they come actually take the census in the next academic year, how many children are there for the first standard, because usually from here, especially the children, those who really want to move to government schools, they used to go to this particular, even not only government schools, even the private schools, they all really emphasize, they come and collect the data, so that they all will get an idea in this particular area how many preschoolers are there who are looking for a school. So these all are the various functions of Anganwadi worker under the ICDS project. I hope you all have understood about ICDS project. Even sometimes, especially ICDS project, they used to ask separately for 5 marks. That's why I have taken it in little detail. There is no need for you to write any of the notes. It is clearly given in K-Park. So you all have to read K-Park textbook, and whatever extra points you have got from my lecture, you can write and keep in K-Park or in your lecture note of community. So this is all about the ICDS project. Thank you, students.